and welcome to this educational video. As most of you are aware, mental health issues and mental illnesses affect the human population worldwide. And doctors, psychiatrists, and clinical psychologists have different kinds of approaches to treat patients, take care of patients with mental illnesses. As all of you are aware, children might have mental illness, adults might have this kind of problem, or even people in their old age might suffer from different mental illnesses. There are different kinds of therapeutic approaches that have been implemented. It could be intervention in terms of giving specific drugs, pharmaceutical intervention, or it could be in terms of behavioral therapy or counseling, etc. But did you know that there is one particular approach which is less widely known, less recognized, and that is the usage of specific mental exercises that are applicable to specific severe mental disorders. So you want to know more about it? We have with us a team which specializes in this particular area, and they belong to a specialized unit of NIMHANS called as Psychiatric Rehabilitation Services. So let me introduce the experts to you. So we have with us Dr. Deepak Jayarajan, who is actually working as Associate Professor of Psychiatry. Namaste, Doctor, and welcome to the program. Next, let me introduce Dr. Krishna Prasad, who is working as Additional Professor of Psychiatry. Namaste, Doctor, and welcome to the program. And finally, we have Dr. Devabrat Kumar, who is working as Professor of Clinical Psychology in NIMHANS. Namaste, Doctor, welcome to the program. So, before I go into the subject in detail, so this word itself, using mental exercise for treating severe mental illness, this is something new to me. So can you elaborate in layman's terms for us, Doctor?
Sure. Before we get into what mental exercises do, I think it's important to understand a little bit of context about how the brain develops.
Okay.
Now we know that human beings have a very large brain as proportionate to their body size.
Yes.
Now we also know that the brain contains around 86 billion neurons.
Yeah.
However, many of these changes in terms of size actually happen on very early in life, within the first few years of childhood.
Correct.
But over time, we also know that the brain continues to change.
Okay.
And these happen well into sometimes even adulthood.
I see.
So when we look at the brain changing, this is an important phenomenon to actually that we can use for our advantage. Why is that so? We know that certain things influence the brain's development, including the environment around a person,
Yes.
the experiences a person has, and certain things like medications and other treatments can also change the trajectory of the brain's development.
Okay.
Now, when we look at people who are at risk to develop a mental health illness or a psychiatric disorder, many of these changes in the brain already exist very early on in life.
Okay.
Now, the advantage that the brain gives us by changing over time is that we can influence it. And one of the ways that we can influence it is by doing some of these mental exercises to look at why changing the trajectory of development.
Okay. That means, Doctor, you're talking about changes that are possible only during development, or can we do it even during adulthood?
That's a very good question. We know that some of these interventions are best when they happen early on.
Okay.
But we also know that some of these interventions, when they're done at any stage in life, do have a benefit.
I see. This is applicable both to the younger population, the adolescents, and sometimes even in adulthood.
Yes, in adulthood as well.
Okay.
And I think in terms of the context of what some of these problems are and what they need, my colleague will be able to tell us, Dr. Krishna Prasad.
Yes, sir.
Yeah.
Tell me, sir.
So thanks, Dr. Deepak. So in terms of persons with mental illness, particularly those who have severe mental illnesses like schizophrenia and other severe mental illnesses, there are specific areas of memory and thinking which are affected. Particularly, these people have difficulties in paying attention, they have difficulty in concentrating, they have difficulty in holding information for a short while and remembering.
Correct.
And they also have difficulty in processing information as fast as what people would normally expect them to do. So these are some challenges that these people face. Now, it is also known that some of these problems actually predate the first psychotic breakdown that these people experience as a part of the illness.
Okay.
And it is the period around the psychotic breakdown that these problems are the most and over a period of time they kind of lessen and are stable for a long while after that.
Okay.
Now, what is important is that this affects the person at a very prime age of their life,
Okay.
particularly while they are engaged in activities like education or a productive vocational period of their life. So it is during this period that it affects them the most, and the illness then substantively affects their achievements both in educational spheres and in the
Okay.
sphere of working.
Okay.
So unfortunately, the medicines that are available are effective for other aspects of the illness, but not so much these aspects of the illness. So
Okay.
the psychotic symptoms, what we call as the positive symptoms of some of these illnesses, are well controlled with the medicines, but these aspects are less controlled with the use of medications. So it is in this context that these mental exercises become relevant.
Okay, doctor. Sorry to interrupt. So you mean to say the one of the approaches that what I understand is to tackle with other aspects which will build towards a psychotic breakdown. Is it like that? You're talking about memory or capacity.
So some of these are identified even in people who are at high, what we call as at high risk.
high risk.
for
That means
developing these.
even before they develop this,
Yeah.
if we are able to identify these symptoms, so such mental exercises could be used to take care of these problems.
Can be of help at that point also,
Okay,
but
okay.
more importantly for people who are diagnosed with severe mental illnesses later on,
Later on,
to
okay.
improve their recovery, both in
Okay.
their personal recovery terms and also recovery in terms of working or in education. This may be of great help.
That means apart from the existing interventions that we talk about, like it might be drugs or any other thing, if you include this aspect also in combination, so that will be a better approach. That's what you're
So,
saying.
so drugs are the primary methods of treating severe mental illnesses
Okay.
like schizophrenia,
Mhm.
but they are not enough. So I think in that sense this makes relevance.
Okay,
So I
okay.
think I will ask Dr. Devrat to elaborate
Okay.
about how to go about doing this.
Okay.
Thank you, Dr. KP. Yeah, first of all, I think I'll just express one thing is that it is not that the cognitive deficits that we are talking about will be equal in everyone, or it will affect, or it will have manifestation in every patient at the same degree or same in the same domains.
Okay.
It is quite established by research that cognitive deficits are one of the very important symptoms that are manifested by most of the patients. And as Dr. KP was very rightly telling that it can be manifested even before the onset of the so-called psychotic symptoms. We call it positive symptoms or negative symptoms. What is most important is that these cognitive deficits can have very important implications for the functionality of the patient. For example, a patient who has other psychotic symptoms, for example, many psychotic symptoms that we talk about, delusions, hallucinations and all, even if it is controlled and the patient has cognitive deficits which has not been tackled, then what happens, the patient becomes asymptomatic from that perspective, but his functionality remains compromised. For example, if he is working at the job place and he is having difficulty in concentrating on the task,
Okay.
then even if he is not deluded, he is not hallucinating, he won't be able to do his work because of the attentional issues or memory issues and all. And that is why if we remediate this, if we also include, as you were very rightly telling, that if we have a comprehensive approach, and apart from medicines and all these things, if we do this also, this will have very good effect. In fact, it is established by research, and it is our personal experience also, that if you do this part also simultaneously with medications and other psychotherapies and other things, that has wonderful effects. So cognitive remediation may be a technical term. In a very simple term, what I can say is something like mental exercise. Okay. And mental exercises, again, you can equate it with physical exercises. When you do physical exercises, you basically strengthen your muscles. By doing mental exercises, you are basically supporting your neurons in the brain. Okay. So when Dr. Deepak was talking about plasticity, what we do by doing all these mental exercises, we increase the plasticity in the brain. So one is that the functions that are compromised can be regained to a larger extent. And if it cannot be regained, sometimes it can happen that it may not be regained at the level before the start of the illness. Still, it can be regained to the level that the brain can, accept it, or brain can, have that kind of improvement. So we have different domains of cognitive deficits. For example, as Dr. KP was telling, attention, memory, thinking, decision making, planning, and all those things. So for each domain, there are very specific cognitive exercises, mental exercises. And if these mental exercises are practiced regularly, and when I'm talking about regularly, it means that you have certain number of weeks when you try very intensively, and after that, even if you try with a little gap, then also it has very good effect. So what is important is that to practice those things are important. Very simple things. For example, anything where you have to concentratively focus your attention for a certain period of time, that can actually improve attention. As simple as this. For example, if you ask a person to color a figure very accurately, so that the strokes are not going out and the colors are even and all, that requires focusing attention, and that will have impact upon improving the attention, which will have impact upon the day-to-day functioning of the patient. So we have very specific exercises, empirically tested, which can improve attention, memory, planning, decision making, and all these things, and that can have direct translation effect into day-to-day life.
Okay, so doctor, what I understand is, suppose a person with severe mental illness comes to you, so you will be able to define, not only from the symptoms of psychosis or schizophrenia, he or she also has these symptoms, and will you be able to clearly say, okay, this person also has attention problem, focusing problem, memory? Can they have all these three, or they can have only one? Is it possible like that?
Yeah, very appropriate question. See, there would be some clinical manifestations by which you can identify. For example, when you're talking to the person, when you're observing the person, some manifestations can happen. But to ascertain to what degree it is and in which domains. So as you were telling that, is it that it is all encompassing, all the cognitive functions will be compromised? Not necessarily. It all depends. So we have very specific neuropsychological tests. And when you do neuropsychological tests, you get a profile. By that profile, you can understand which function is, compromised, which function is not that badly affected. And based on that, we actually plan the neuropsychological cognitive remediation planning. So, very rightly said that when we do cognitive remediation, we first of all ascertain what cognitive functions are compromised and at what level we have to try for that.
And when I was discussing, I also thought that this might not be the frontline intervention compared to other conventional approaches. But why do you think this has happened? Is it because it's not very well recognized or underused, or why do you think this component is missing? If anybody can comment on that.
I think there are two aspects to it. One is preventive. Can you identify somebody who is at high risk by looking at whether they already have certain early signs of compromise and working on them? And there is another approach where you look at people who have developed mental illness and look at helping them overcome some of the challenges that we've just discussed. The work tends to be intensive. You do need somebody to assess these problems. You do need to practice these problems over time under supervision. And I think that is the major barrier in adopting these in a generalized way for all people with severe mental illness. For at the preventive level, I think there are some efforts right now to look at the effects of intervention very early on, even before somebody develops signs of mental illness. So I think it's important to extend this approach not just to people who have the illness, but to look at things like a vulnerability to develop mental illness. And if we are able to address this, then we can actually reduce that vulnerability over time.
You mean to say this is, let us say, in case of people who have a hereditary component. Let us say a person comes and that sibling might be affected or child might be affected in future. Is it applicable only in such circumstances? How do you look for the vulnerability component?
Right. So again, that would have to be assessed from person to person. If a family member has mental illness, we would have to address that, assess that person and see whether they have a vulnerability. Right now, this isn't a widely used approach. It's more at the level where it's being researched and it's being looked at as to how can it be made widely available, which components are more important than others, and who will be best helped by it.
Okay.
So I think the challenge in terms of what you asked about, can it be widely done, is to who can do this, at what level, and how can it be widely done in terms of being widely available. I think those are challenges that are still before us.
One of the areas is that important areas here is the lack of resources to do this. I think that because it is time intensive and also human resource intensive. So in routine practice, I think it kind of goes under addressed. That is because one is at the level of identification of the problem itself. Second is because of the human resource intensiveness of this. I think this takes a backseat, and the pharmacological approaches are an easier approach because they also affect the most problematic behaviors.
That means you need a trained professional who will look at all these symptoms apart from the main clinical symptoms.
Yes.
So this is like a combination. When I say trained professional, is it a psychiatrist, is it a psychologist, or a combination of both, or how does it work?
To a large extent, it can be practiced by any mental health professional. But I think this is also an area where some degree of specialization and some degree of training is required. So, but I think at least at a basic level, identification and some basic level of addressing these areas become important. But I think a full-fledged intervention would require the assistance of a
Having said that, I think it's important that my colleague Dr. Devrat can tell us further, but I think there is evidence now that early intervention early on in the course of mental illness is actually the best approach rather than waiting and then doing it later on. Dr. Devrat?
No, very important issue that is being discussed is that why this intervention is not that commonly used and at what stage it should be practiced. One is that I think NIMHANS has taken very important step in that. We have conducted research. I have finished one research and we published it very recently, where we have done intensive cognitive remediation with the help of caregivers. Okay. And one of my colleagues also, she has already done it with caregivers. This one. So we have successfully tested it that systematic cognitive remediation can be done with the help of caregivers, so that you decrease the load on this one. Of course, we have to do some hand holding. It's not that you just train them once and then everything is done. But then coming regularly to clinic can be shortened, and it has two benefits. One is that patient does not have to come regularly. The second thing is that clinician does not have to get involved regularly. So that is one input that I would definitely like to give. We are planning to test it at a wider level.
But there's one important aspect you told, doctor, that is very important for the audience also. That means once everything is put in place, even the caregiver, that is the patient's relatives, family members, can be trained to do these kind of mental exercises. So once you set the platform, so it's you leave it to the patients in their house. They can do it. This will be more comfortable for them. They don't have to come back for a visit. But periodically there will be a follow up. But day-to-day exercises can be actually be carried out. That's very helpful. So that patients are now comfortable doing this in their own home or.
Technology also is something that can be harnessed towards this. I think Dr. Devrat may elaborate. The use of computer-based remediation programs is something that can be used in the current digital age. So I think Dr. Devrat could also
that's what I wanted to ask, because talking about, using all mental exercise, I'm just trying to understand. So in lay terms, if you can tell us, let us say for attention problem, focusing problem, or memory problem, what specific exercises will you prescribe? Maybe as a manual method, or like he said about computer-based method. Can you briefly tell us?
This is what actually there are quite a few.
Okay.
And elaborating even couple of them will be difficult here because you have to explain on
Okay,
paper pencil how
okay,
it.
understood.
So I gave you one example. The one another simple method of improving attention could be that take a jar
Mm.
and mix different color of beads and keep in that jar and ask the person to separate all those
Separate,
beads
okay,
in
okay,
different colors.
Mm.
It requires attention.
Requires attention. Correct.
Okay.
Correct.
So there are a couple of things
Mhm.
by which, for example, you take a newspaper clip and then you ask the person to cancel two letters, for example, D and S, for next 10 minutes. So he has to focus his
Correct.
attention on
Mm.
cancelling D and S,
Mhm.
and he has to ensure that he should not be cancelling any other
Any other, okay,
letter,
okay.
and at the
Mhm.
same time he should not be leaving any D and S.
Mhm.
Okay.
Mhm.
And then you can go to the next level once the person has tried for a week or so and there is no error now happening.
Mm.
Then you can increase the complexity by you telling that you have to cancel all the A and K, and you should not be cancelling any A which is preceded by D. Okay.
Okay,
So
correct,
so now
correct.
it increases. So he has to focus more
Mm.
to ensure that he does not have to keep cancelling A's.
Mhm.
He has also to see that no A's should be cancelled which is being preceded by D.
Mhm.
So this is what I'm telling, that there can be many things
It's a battery
which can be
yeah, yeah,
tried.
yeah, yeah.
For memory
Mhm.
also there are lots of things.
Memory,
For problem
okay.
solving
Mhm.
and decision making also there are lots of things.
Mhm.
And if these are tried, and as Dr. Deepak was saying, very important aspect is that
Mm.
as soon as you start all these things,
Mm.
actually you are preventing many other things that can happen in future. And
Ah.
and
Mhm.
it also saves the person's quality of this one. For example, even if a person is little symptomatic,
Mm.
that does not deter him to do his work.
Mhm.
Okay. What creates problem is this kind of dysfunctions.
Mm.
So if you are taking care of this, the person may have some symptoms but he can do his job.
But I think what I understand is you can make it as simple as separating beads of different colors or
yeah.
striking letters in a newspaper.
Yeah.
It is something they can do at home also.
Yeah.
Once you teach them how to do it, then the caregivers can do that, and they can advance from simplest remediation to a more complex.
Yeah.
But doctors, in your opinion, how long do you think this should happen before it shows a positive effect in these patients? Is it days or weeks or months or?
Literature shows that 8 to 12 weeks of practice
Okay.
brings kind of where you can see the effect. But there are literature which says that even as less as 6 weeks of practice has certain changes.
Okay.
Most of the trials that is done, what is important is that first of all it's not that you practice for 12 weeks and you leave completely.
Correct.
It won't happen.
It
so this is
should
what
be
I'm telling, that
continuous, okay.
it should be continued.
Continuous, okay.
There should be an intensive part, and then you can but see, this is what all these exercises are, is something like you are strengthening your neurons. Okay, so it's very similar to if you do some physical exercises, you do for 2 months, there is effect on your body. But then if you just leave
If it is continuous,
then again
correct.
your muscles
Exactly,
start
yeah,
losing those
yeah.
capacities.
Yeah,
So
yeah.
it is always better, and that too in case of mental illness, when as Dr. Deepak was telling, that there are certain propensities which are there. So if practices are done regularly, it is very good. And so many, for example, Sudoku and crosswords and all those things, all these exercises can be helpful.
That's what actually I was leading to. That's a very good thing what you told. So looks like this kind of mental exercise can be done even by other individuals who might not have these symptoms, just to improve their attention capacity or improve their memory and things like that.
There is a whole concept of cognitive reserve.
Okay.
And the cognitive reserve is that it applies to all of us.
Okay.
If you practice regularly these things, you create a cognitive reserve. And so at certain age, when the neurons start dying and all, we're actually making them survive longer.
Survive longer. So what I understand in lay terms is, and doctor also told about the plasticity. So either due to disease or due to age, what happens is there is loss of strength or loss of connections of neurons in the brain. So this is a very important and also powerful approach, so that all these connections are strengthened,
Yeah.
and those neurons are strengthened so that your capacity, mental capacity improves. And this is more applicable to people who have mental illness.
But
So
equally applicable to all of us.
equally applicable to people like us
All
also,
of
so
us,
who can
yes.
improve on this.
Yeah.
So how do we decide? I don't know, I think we might have touched this. So in a nutshell, how do we communicate to the public, saying that this thing is possible, this is applicable, as a message? If you can tell a couple of sentences each into the camera, that will be helpful.
I think importantly, I think there must be demand, and that, as my colleagues pointed out, sometimes when people are not creating a disturbance or a problem because of what we call positive symptoms, people are okay with them doing whatever they want to do. I think it's important that people understand that this approach exists, that if they're having problems with their attention and memory, that there is a solution that they can tap.
Correct,
And I
correct.
think that's why a demand should be there.
Okay.
I also think that a wide spectrum of approaches should be available, some which can be done at home, some which are computer based, so that different people with different needs can access different types of
Correct, correct, correct.
I think people with severe mental illnesses, a lot of their goals and aspirations are affected, and their goals and aspirations need to be reshaped after this whatever crisis that they face. So subsequent to that, I think this becomes an important ingredient as a part of that recovery journey that they have,
Okay.
and reshaping their focus back into the mainstream community.
My message is that is very important component of the comprehensive management, and it is not very difficult. It is just not being used so widely, but gradually people are realizing the importance. And for example, in psychiatric rehabilitation and all, this is now becoming an important component of everything. So people should understand that beyond medications, there are certain things which are very much required, which are equally important for making the person functional and resume their day-to-day activities the way they were before the illness. And this is one of the very important components.
I think thanks for putting a positive outlook on this. So now we know that apart from conventional treatment, there exists a specialized approach where we have mental exercises. That too, many I understand, which can improve the mental health, take care of other problems associated with severe mental illnesses, and also be helpful to other people in public. Thank you for sharing important information. Thank you for participating.
Thank you very much.
Namaste.